Hey guys, it is such a pleasure to have you guys here today. We have a really interesting talk to get into about career changing, specifically in medicine, in the career of medicine. So today we have Rakiyah and we have Jessica. So if you guys can just tell the people who you are, what you did before you got into medical school, and where you are now.
So hi guys, my name is Jessica. Prior to starting medical school, well, I am a registered nurse. So that's the path that I took. I started as a CNA, LPN, RN, and now I'm going for my MD. So I worked as as a nurse for close to 8 years, 9 years before deciding to go to medical school. And the last few years, I was just in the ICU.
Perfect. Awesome. Hi, everyone. My name is Rakiyah, but everyone calls me Kai. Like Jessica, I'm a nurse as well. Took a little bit of a different path. I was a nurse in the Army I'm still a nurse in the Army for the last 12 years. I was on active duty for 5 years, and then I became a nurse practitioner. Also a professor at Columbia. And currently stationed in California doing COVID for the military as well. So that's my path. It's been all over the place. I also have a private practice in Montclair, New Jersey.
Oh, nice. I didn't see. I feel like I learn new things about you every time. It seems like you guys had like very full lives before deciding to say we're gonna go to medical school. So what made you want to make that shift?
So in my case, I've always wanted to do medicine. It's just life took me in a different way. And I did nursing first. But doing nursing just reinforced the idea that I really want to be a doctor. Once I got to the ICU and being able to see like the residents, the workflow, what they do, and how much more you can contribute to um, the management of your patient as a physician, that pushed me even harder towards that, the goal of becoming an MD. Nursing is great. I love nursing. I just wanted to be able to do a whole lot more and be more involved in the care plan of my patient.
Mm-hmm. Yeah, I think that's funny that you said that, because I remember when I was little and I had really bad asthma. And so I always had to go to the hospital a lot. And I was so confused because I thought that my doctors were the nurses, because the nurses were always in there. They were the ones tending to me. So I was like, Mama, can you call the doctor? But I was talking about the nurses. So it's interesting that you say you want to be more involved, but I guess like in the actual plan and long term kind of. Kai, would you agree?
Yeah, so my path was a little different. I initially was in the BSMD program when I was in undergrad, but being so young, became overwhelmed and crossed the street from the medical school to the nursing school. And for me, it was mainly just because, like Jessica said, I was, doing pre-rounds with everyone, during your early years of being an undergrad, and just noticed there was like no time with the patient whatsoever. And at the time, everyone seemed stressed and unhappy. So I was just like, no, let me get out of here and go with the nurses, where everyone seemed more happier and more engaged in patient care. So for me, I really didn't look back into becoming an MD. I love being a nurse. I still love being a nurse. I love being a nurse practitioner, but it wasn't until I hit the roadblocks that I hit as a nurse practitioner where I was like, okay, I'm back at the stage of needing to become an MD in order for me to get to really where I want to be. And that's what made me rethink the idea of being an MD versus remaining an MP.
Okay, cool. So would you mind, Kai, just talking a little bit more about, because you said you experienced roadblocks as an NP. I think a lot of people, when they're on, they're in pre-med, they're like, I might as well just be a nurse practitioner because it's pretty much the same thing. So what are those differences between nurse practitioner and physician?
I think that's a tough question to answer only because it's really specific to the state that you are in.
Mm,
It varies from state to state. There's no like federal policy or law to regulate nurse practitioner practice. We're kind of working on that. So depending on what state is whether or not you have independent practice, whether you require a physician for just prescribing, or if you require a physician just to even treat or say hello to a patient. It depends on that state that you're in. Where I'm licensed in both New York, New Jersey, and they're a bit opposite. You know, New York, I have more independent practice. New Jersey requires me to have a physician in order to prescribe, but I can diagnose you, I can see you, but in order for me to write a prescription, I require a joint protocol with another physician. So for those things like that, it becomes really, really difficult when you cross state lines and having to make that connection, having to pay someone or not pay someone, depending on the connection you have with this joint protocol with the physician. So when you really just want to practice and see your patients, it gets really a bit difficult navigating those different environments and spaces.
Okay. I didn't even know that it changed, it varied by state, because I was I was misinformed, and I was telling someone just the other day, like, oh yeah, nurse practitioner. So I like to say, it's like the same thing. They can all prescribe medicine and do this and that. So that's I'll have to go back and tell them that I was I was wrong.
Yeah, so you can do it. It just requires you to have a physician protocol.
Right.
Collaborative agreement is usually what they call it with another physician.
Mm-hmm. Nice. So, Jessica, how do you think the transition was between nursing and then starting medical school? Because how long were you a nurse for? I don't know if you said it. I'm sorry.
Like I said, like 8, close to 10 years. I would say almost 10 years.
Okay, so you finished medical school a while ago. I mean, nursing school a while ago.
Mm-hmm.
So how was that transition for you, like working all this time and then like going back to school?
So it was not that hard of a transition just because I was working and also taking my prereqs for medical school. So yeah, so it was just like a continuation, a little bit of that. Like I think after I took my prereqs, just I had a 1 year gap where like I was not in school. So I don't think the transition hit me really hard when it comes to that. Now, if I have to compare nursing school with medical school, Kai can attest to this. I've forgotten a lot of stuff from nursing school. He'd be like, "We learned this," and I was just like, "Did we? Did we learn this?"
I forget things from term one.
Yes, exactly. So let alone nursing school. He was like, "We learned this, Jess. Remember, when they tell you they drill this in nursing school." I was like, and like there's certain things I do remember and it helps, but I feel like it's more like my clinical experience right now that's helping me with the transition for medical school than anything else. Because yes, I do have a little bit of foundation as far as like what I learned, but do I remember most of it? No. I remember most of the things I did at work, like managing my patients, the medications that were on, why I gave it to them, like when I had to explain some kind of side effects to the patient. Those are the things that like that actually stick with you. So yeah.
That's really cool because I from the outside, just being like someone who didn't necessarily change careers, I felt like, because you guys are in term 2 and you're going into term 3, correct? I felt like term terms 1 and 2, I kind of felt like, oh, I don't feel that like that aspect of like the clinical aspect. I didn't feel that in term 1 and term 2. But so the fact that you guys say that helped you in term 1 and term 2, that's a really good sign, because term 4 is all like it feels like, wow, I'm learning about like real that patients will come and see, and I'll see. So that's really interesting to hear. So the next question we have is just very simple. It doesn't necessarily have to be about, the career change, but how did you guys choose your institution, the current institution that you are at?
So in my case, so The first time I took the MCAT was right after I had a back injury. So I had a back injury in the SICU. I had a patient that I had to take for a barium study and ended up pulling my back, and that put me out for like 7 months. So uh, during that period, I had to reschedule my MCAT test. So because of everything that was happening, I didn't get the score that I wanted to get. So then the second time that I had to take the MCAT was in the middle of COVID, like when we started COVID. So this is when like all the craziness is happening. I wasn't staying at home. I was staying at a hotel um, because I didn't want to bring back COVID home because I was still in the ICU at that point. So during that time, again, I did not get the score that I wanted. So when I saw that, I was just like, I cannot keep wasting time and keep applying to US schools. It's not like I'm 22 or 23 applying to medical schools. I was just like,
Right.
SGU is a good route. I've seen people succeed from it. There's an attending that it's at Columbia. He actually went to SGU. He did his residency at Columbia. And he's attending now at Columbia. So just that, I was just like, I've seen success stories. So I was just like, SGU is a good route. So that's how I did up there.
For sure. I think a lot of people end up feeling very secure in making decision to go to SGU because they see like the match rate, they see that they have opportunities to practice in many different places, and they just say, you know what, this seems like it's going to be the best fit for me, and I'm just going to start. Like, I think the whole process of like the med school, like the whole AMCAS process is just kind of really overwhelming.
It is. It really is. Yeah, I agree with that.
Yeah, I definitely agree. I think for me, it was looking at the prereqs and contacting schools because, like Jess said, we aren't getting any younger, and my prereqs were over 10 years old. Some of them were hitting the 15-year-old. Oh God, I'm dating myself. And they were like, well, maybe just try taking organic one or just repeat in biochem. I'm not doing that again. No, I have like umpteen degrees, and I wasn't going back to the drawing board. So I wanted to go to a school that was, looked at those who had life experience or clinical experience and have been out here a little more favorably. And SGU did that. And then when they gave me the scholarship, I was just like, oh, okay, definitely no need to apply anywhere else. So I just did, and SGU has been great.
Awesome. Oh, guys, I am so like happy to hear about your journeys and like just okay. So for the people viewing, I know them and we talk a lot. And we talk. I've known Jess, and she did a pre-matriculation program before she started term one at SGU, and then she introduced me to Kai, and they've just been flourishing. Like they're gonna be such great physicians. So this is really good. And our IMGs Connect founders wanted to know, they were just like, we just are interested to know what they're going to do in the future. So they want to know like what specialties you guys want to go into after you graduate.
It's funny you asked this. Me and Jess talk about this all the time.
Really?
Because she's trying to pull me one way, and I'm just like, I'm sticking to what I know. My bread and butter, internal medicine, is what I know, is what I do every day. But I'm going to do endocrinology just because I do a lot of transgender health and medicine now. So being able to continue on with that as an endocrinologist. So I'm going to do IM and endo.
Nice.
Anesthesia for me.
Yes, I remember you did tell me that. That's awesome.
Yeah.
So
both of you to come to anesthesia. Maybe.
I would never. That you gotta be like a really strong yeah. Before you go, I want you guys to drop some gems for anyone else who's like, non-traditional, going into medical school from a different career, do you have any advice for them? Any words of encouragement for these students?
If you are an older, more established, more mature individual like some of us, do not be intimidated. Your life experience brings a lot to the table. And actually, you will find that those who are younger will see that and actually start to move more towards you and what you think or what your suggestions are, just because we can navigate life differently, right? Every day is hard for us, but we've learned a little bit more about how to navigate those spaces and keep pushing and have those good tools in our toolbox. So do not underestimate how much that will play a huge role in the journey of medical school, because medical school is tough. It's something it's a mental game, and we're just better at playing a mental game sometimes as you get older. So just don't underestimate that and what you bring to the table with that.
I agree 100% with Kai. Yeah, the way he said it, couldn't have said it better. But yeah, I would say definitely do not be afraid. Don't second guess because you're like, oh, I'm getting older. Everybody's doing this at a younger age. Like, really, that does not matter. Again, like Kai said, your life experiences will help you tremendously. Will give you the stamina to keep pushing, to keep going forward, and just knowing, just the fact that you've had that life experience and you know who you are will help you do well. Will help you do well in medical school because you know what your goal is, you know why you're doing this, you know what your focus is. So yeah, just jump in. I just close your eyes, just go for it.
Keep pushing. Kick,
Yep.
push.
Amazing advice. Amazing advice. I love it because it's true and I've seen it firsthand. I've been in classes with people who have they have so much experience, and just because of that alone, it's like they're 10 steps ahead. And you're just like, ooh, maybe I should study with that person. Maybe they can teach me a little something. So thank you guys so much for this little chat. Hopefully we can talk more in the future. Do you guys have anything else to say to the people?
SGU is an awesome choice. I'll definitely tell you. They have a ton of resources. Come on over to SGU. It's a great place. It really is.
I think SGU is a good school, and I know a lot of people who do the career change go to SGU and they do really well too.
Yeah.
So, all right, y'all. That will be it, and I hope you guys enjoy the rest of your days. And I'll talk to you soon.
Thank you. It was a pleasure.
Thank you.
Bye.
Thank you for having us over.